there, I'm Michael Jonas from CommonWealth Magazine. Today on the podcast, taking stock of the pandemic with two leaders in the Massachusetts community hit hardest by the virus. It was a year ago that our world was turned upside down by coronavirus, and no place in Massachusetts was turned more upside down than the city of Chelsea. In April of last year, it had the highest coronavirus case rate in the state. A year later, more than 8,000 of Chelsea's 40,000 residents have tested positive for COVID, the highest per capita rate in the state. Joining us to talk about what Chelsea has been through and where it is today and where it's going are Tom Ambrosino, the city manager in Chelsea, and Gladys Vega, executive director of La Colaborativa, a Chelsea nonprofit that has been at the forefront of delivering resources and services to the hard-hit community there. Gladys, Vega, thanks so much for joining us. And just take us back to those days in March of last year. And when did you realize that, that this virus was coming for Chelsea in a big way?
Somehow in March 5th, when a woman from the Boston Free Food Project offered a truck full of food. And I know that some of our staff were not in the office. Everyone was pretty much gone. And we were supposed to be going to an Irish celebration held by Senator Sal Di Domenico. And this food truck came to my house. I said, let's put it in the truck. And I remember that I did a posting on Facebook, and over 250 people came 10 minutes after the post. And I was like, oh my God, what is happening? And how come people in our community are already looking for food? And people were telling me I've been laid off. They cut my hours, people are getting sick. And for me, that was sort of like the beginning of this amazing journey in terms of trying to get food security and sustain our housing situation. So that for me was, it was a critical time for us to basically work with our community and provide. We were never in the food business. We became involved in food just because we identified the need, and we used the food line as a lifeline to ask people while they were in the food line, what else can the Chelsea Collaborative do for you? What else can the city do for you? And then that's how we identified 389 people that were COVID positive in the line of food, and we began our delivery service. And from there, we've been doing very innovative new things that we were not doing before.
And I mean, it's sort of in terms of having to innovate and figure out as you were going along. I remember Tom, we spoke back in April, just sort of weeks into this, and you said at the time, "There's no playbook here." What was it like for you in those early days as the city manager in a community that was really being overrun by a virus, but one that people really were still trying to figure out, and we didn't have, a very much understanding of it?
Yeah, I think it was just, we started to receive anecdotal reports, some coming from Gladys, of how the virus was starting to impact the community. Individuals were being thrown out of their apartment because they had COVID and roommates would not let them in. People were becoming immediately and overnight homeless because of COVID issues. And as Gladys described, the food insecurity was starting to skyrocket. And so we realized at that point that this virus was really having a disproportionate impact on our city. Our police chief at the time, Brian Kais, was collecting statistics from other communities, from other police chiefs about the impact of the virus. And when he shared them with us, we saw how significantly higher the numbers were in Chelsea. And at that point realized that we had sort of a unique situation here. So it really required us to scramble and to, as Gladys said, try to do things innovatively that none of us had done before. Gladys, as she said, was never in the food distribution business. We were certainly never in the hotel business, but we had to get into that with our neighbor Revere in order to meet this need where COVID positive patients had nowhere to go.
Right, and I remember at the time, I think what you're referring to was this arrangement where some nearby hotels were set up as kind of quarantine stations where people could, go and leave their households to try to not expose family members and others. Can you talk a little, Tom and Gladys, both about, help describe what made Chelsea so vulnerable? What are the circumstances there that led to it becoming such a hotspot for the virus in the state?
So for me, I think it was, as a low-income community, I think was years of a community that has been neglected. The fact that we have, absentee landlords, the fact that the proximity to Boston has sort of like punished us, right, in terms of the high cost of living. We are a city that slowly became gentrified. I think also that in order for people to afford Chelsea, you have 3 different families living in a 3-bedroom apartment, and they may be family members with the brother and his wife, and then the mom in another room, etc. Or pretty much 16 strangers per a 2-bedroom apartment or a 3-bedroom apartment. So for a spread like a virus like the coronavirus, this was the ideal setting for a pandemic like this one. So that is why I think that the spread, took it took us completely in by surprise, and it really hit us extremely hard. But you also have to understand that the living conditions were bad, but also 80% of our community members work in the service industry. These people were working in hotels. They were taking the T to go to Boston and clean offices. They were working at the airport. So they were working at the produce center, and nobody had enough masks. People didn't have gloves. We had basically nothing. Our staff was providing boxes with very limited resources, and people in the line were with the coronavirus positive themselves. And they would tell us, I just tested positive, but I have no food. And we would literally remove them from the line. So I think all those things contributed to us being sort of like the center, the epicenter of the pandemic.
Yeah, I would echo what Gladys said. I mean, this is a virus that really spreads rapidly in crowded conditions, and the people in Chelsea live in crowded conditions. They go to work in crowded conditions, mostly on public transportation, mostly on buses, and they work in crowded conditions in grocery stores, in food manufacturing facilities, in hospitals as essential workers. So because their whole lives is around crowded conditions, this is a place where lots of people got sick.
Mm-hmm. And I remember also back in April, Gladys, when the National Guard was doing food distribution, but you also and others in the community were setting up sort of pop-up food pantries in other locations. And I remember talking to you. I mean, you were, I don't even know how many hours a day you were going. Was there a time around then or during the pandemic when you just sort of felt like, did you worry that things were just sort of spinning so out of control? And again, this was such an unprecedented thing. We did not know exactly the kind of trajectory it was going to take. Did you have a moment when you sort of just felt overwhelmed and that you just weren't really sure, just about kind of moving forward and handling it?
So, Michael, I remain overwhelmed every day.
Yeah. Because
the situation hasn't gotten much better. People are being displaced, and situations in Chelsea they're like different. It's a different era now. But at that time, we actually we were reacting and constantly reacting, and we were como robots. We were literally like in this, like you wake up around 4 o'clock or 5 o'clock, knock on the doors of the warehouses in the New England Produce Center, find out whatever they're not using that they're able to donate, put in that truck and take it to the 318 Broadway. So we were in sort of like reaction mode on a regular basis. But I tell you, I think the hardest thing for me is that I'm very emotional. I hug people, right? And I had to pretend that everything was okay. And because people were relying on me to guide them and to lead them in whatever it was, to tell them it's okay to go to Riviera for a hotel. It's okay. They're going to provide food. They're going to, you, nothing to do with immigration. They're going to ask you questions, but it's okay. It was so hard because at times I wanted to be on a constant crying mode, but I have to put this mask on to make sure that people felt that I was strong and that I was saying, it's okay. We're going to be okay. We're going to make it. Just, go to the hotel. Just tell your family members that you have the coronavirus and that they need to get tested. I think the hardest part, Michael, for me was the city of Chelsea didn't move quick enough with testing. I think I kept being extremely concerned that the testing didn't happen right away. And I respect the fact that because of the unknown, people were saving the test for the essential medical workers and the first responders. But I kept saying in my community, people are dying. People are extremely sick. Unless we test them by sending them home and the hospital not saying, I send home 300 people, we're not pushing for, quick tests. So for me, and until this day, just because we have vaccination, I still push for testing. I don't want people to feel that because we're getting vaccinations at the levels that we're getting them, people should not be getting tested. I feel that they both go the same way. My staff members got all the vaccinations at the food pantry and at the collaborative, a la colaborativa. And every 2 weeks, I'm telling them, we're going to go and get tested every 2 weeks. We have to. So, and I do it not only because of our safety, but also to demonstrate to people that unless we continue to do these things, we're not going to heal, and the pandemic is going to continue to happen.
And Tom, I know there was a lot of question early on about testing, and again, the state was scrambling to figure out, would they set up these kind of, public sites in, public, parking lots of grocery stores. I know in Chelsea there was initially a focus on some of the big public housing buildings. Do you sort of, looking back, again, everything was happening quickly and a lot of unknowns, as Gladys said. Do you have regrets, or do you sort of, in looking back, are there things you might have done differently? I was also struck looking back at when you and I spoke in April. You said something that's very unusual for public officials to say, and you said, I'm making mistakes, which I think goes without saying that was true for everyone at the time. But in looking back, how do you think about things?
Certainly lots of things could have been done better. Gladys mentions testing. It took a long time for us to get to a point where we felt we had adequate testing in the city, but it was clunky at first, but we got to a point where we were doing testing well and continued actually in the city to do testing well. I feel like we're sort of at the same point with vaccines. It's clunky. The rollout is slow. It's frustrating for people. I'm hoping that another month from now that we will sort of be where we were with testing in September. Like, it worked. It was set up in the city. There was adequate locations. People who wanted to test could get tested. I'm certainly hoping that that's where we are in vaccines if we are we're looking back 30 days from now.
In terms of vaccinations, there was a story just a couple of days ago reporting some pretty troubling figures in terms of vaccination rates among Latinos in the state, and looking at the communities with the largest Latino populations, including Chelsea, which the story in the Boston Globe said the city was 68% Latino, but only 7% of Latinos in Chelsea have been vaccinated, compared to about a third of the white residents. What's going on there, Gladys, in terms of getting to vaccinations?
So I think it's a combination of different factors, and that is why tomorrow we are going again we've been doing this for 3 weeks, and we're going to do it until the end of March. We're going out with senior nurses, physicians, knocking on doors, just to basically talk to people about vaccinations. Mm-hmm. Also, the rollout, it's a little bit too slow. Also, the system that the state had in terms of the computer system going down, the program that they were using not working. Um, people do want to get vaccinated. I've been advocating a lot for mobile vaccinations. I have right now close to 750 names of people from the produce center. I have their names, their birthdays, their phone numbers and addresses because they're ready to be vaccinated. They work in the food service industry, and they said if a Stop and Shop is allowed to get vaccinations, we should be getting vaccination because we work in the food industry. So I think in terms of, I think it's different factors. The fear also of people not knowing about the myths also. I think that, people talk about Moderna versus Pfizer, and how Moderna means that it's more modern than Pfizer, which it could be like falsa, like false in Spanish is close to that. So all these things have contributed to people being a little bit slower, but we have a waiting list. I really think today that is not so much the case. Today is basically that we're not getting enough. I think that Chelsea is not getting enough vaccinations, but I really think that if you were to tell me, Gladys, we have 10,000 Johnson and Johnson vaccinations coming to Chelsea, I tell you that the magic will happen and we will get people vaccinated. We're doing everything in our power to educate them and to deal with these myths and these rumors about what works and what doesn't work. But I actually think it has to do a lot with the amount and the different levels of the rollout.
And Tom, I know that there's been some concern about the way the vaccination distribution is working, and concern that some local health departments have been kind of cut out. I know that the head of the Chelsea Public Health Department was one of several dozen leaders across the state that expressed that in a letter this week. Do you have concerns about how the vaccination system is working?
I think a lot of municipal leaders have felt that working more closely and allowing local public health authorities and local boards of health to be more involved in this vaccination effort would be more beneficial. I mean, certainly in phase one, when we were vaccinating first responders and home health aides and home health workers, there was a lot of reliance on local boards of health. They were effectively delivered those vaccines to their first responders and to home health aides and home health workers. And I think a lot of us expected that process would continue. The state pivoted to these larger mass vaccination sites. And I think a lot of municipal officials feel that hasn't been the most effective way to deliver vaccines. But, I don't want to be overly critical of the governor's efforts. This is very difficult, and frankly, a large part of the problem is just the constraint on actual vaccines themselves. If we had, if supply weren't an issue, I think 90% of this problem would be solved, and I'm hoping it will get solved as the supply starts to increase, and the expectation is that it will, and we might just be, 30 days away from that.
Mm-hmm. And so we've heard a lot about how, in places like Chelsea, the pandemic has sort of exposed or exacerbated these huge inequalities that already existed, whether in health, housing, all sorts of areas, and that's been a constant theme. But I guess I just wonder, do you think are we learning from that, and is it going to make a difference going forward, Gladys, or do you worry that it'll be sort of back to business as usual?
So I hope it's not back to business as usual. I think that the stuff that we've seen around housing and the displacement that is happening, the people that we get in our office. So we work with two different groups. We work with housing families and CAPIC. They've been like an incredible two partners in terms of helping us financially set up, and of course the city setting up, transitional housing. But I tell you, it's from right now we have 13 people, 14 people today, 14 people in hotels. And every week we get from 11 to 15 people in hotels. People come out of the hospital or they go out shopping. When they come back, their locks have been changed. And then we have to get a police officer because when Norielis, who is our housing director, calls the person and says, could it be possible for Mauricio to pick up the clothes and the bureau that he left behind when you evicted them? What they basically say is Mauricio owes $6,000. Unless he pays, we're going to hold his belongings until he pays. So there we have to work with our friends at the Chelsea Police Department and ask the chief guys to give us a detail for 20 minutes so we can send our food truck with our employees to remove everything real fast. And then we are storing it in the second floor of our food pantry. But those situations are like severe. And I tell you, Michael, I wish I can lie and tell you the 2 years from now, we'll be better off. But unless we are creating jobs and different skills, and unless we are securing some type of transitional housing, some type of housing where a person can live and not share a 3-bedroom apartment with 16 other people. Unless we do all those things, our situation is not going to be anytime soon better. Like we tell people, when they said we're getting evicted, I'm like, okay, tell me how much you owe. Or we owed, from 10,000 to 15,000. Or those individuals that say I owe $500. I'm like, okay, get your landlord on the phone. We're going to write them a check, and we're going to write them a check for 3 more months to secure housing. Those are the crazy things that we've been doing.
And Tom, how do you feel? Where is Chelsea at right now? I think we've just seen that it's actually fallen out of the red zone, the state's way of mapping the severity of the virus. So the virus, rates are down somewhat, but I think, as Gladys points out, the impact, the sort of devastation that this pandemic has waged and left in the city seems very much still going in ways that are you're not going to sort of turn a switch and climb out of it. We know in other communities, I think people are back to work. We hear there's traffic resuming on the highways. It's sort of like, but it does not seem like Chelsea is anywhere close to that stage in terms of the state of things for folks there.
So as you mentioned, our daily case counts are down, and that certainly is a positive step. But the economic impacts, as Gladys mentioned, are lingering and will linger for a long time. And I think that it cries out for a need for long-term, sort of sustained government support to deal with the ongoing housing insecurity issues, the ongoing food insecurity issues, the ongoing problems that small businesses would have. I think there's a real need for government to step up in a much bigger way than it ever has in the past to provide sustained help. And I will say that this American Rescue Plan Act is a step in that direction. There is sustained support in that act, and I think that's where government, not just at the federal level, but at the state level, needs to go if we want to ameliorate the problems that have been caused by COVID.
And what, Tom, do you sort of take away from this whole experience as a city manager, as a public official? What sort of would you say are the big lessons that you've maybe learned in terms of how to approach crises like this from your perspective?
So I think it's a lesson that there is an important role for government to play in people's lives, and government can be a source for doing real good and helping people in times of crisis. And I think you saw the difference between poor government at play and good government at play, both at the national and state and local levels. I think this was a lesson in how good government can really make a difference in people's lives, in making things better during difficult times.
Mm-hmm. And Gladys, I was just going to ask you, maybe sort of in closing, looking ahead, you talked about how, you've been sort of forced to just be sort of almost on autopilot or keep going and kind of keep your resolve, for the people that look to you for leadership. Do you think, I don't know, down the road, is there going to come a time when you finally, kind of are able to exhale? And do you think you'll, at that point, it might, there might be a delayed effect. It may sort of hit you at that point that you can kind of really come to terms with this horror that you've been in the midst of?
So I think I would begin to feel that way once 80% of my population and my neighbors are vaccinated. Just a little bit of that healing process that we're heading to the right direction. It's been a full year of since the pandemic took this toll on all of our community, and I tell you, it changed my life drastically. Our families and our business forever will do things differently. I really think that we will all take things differently from now on. I think we loved Chelsea before. We value our community, but the sense of neighboring, the sense of unconditional love for others has grown to a place that is so different than before. How I see my hope is that we were so fearful for all the unknowns that fear made us stronger. And I think the resiliency of our people that were able to survive this pandemic in the worst condition, right? Looking for food. I mean, we have young people that have told us in our year-round program that they are giving up their rooms so that their parents can rent it, so that they can pay for the rent or that they can buy food. I mean, so those are the situations, but that they're not mad at their parents. No, really tell me, Gladys, he told me he's not mad at his parent because he knows that his parent is on survival mode, and that in order for them to sustain our home and our siblings, this is what he needs to do. And for me, it's like, wow, incredible, like everything that people are doing in order for them to cope and sustain families. But I agree with Tom that federal funding and other strong resources must come to Chelsea, but not in small amounts. It has to come in large amounts because we have been neglected. The blanket of poverty was lifted with the pandemic. We were already extremely poor. So I really think that, through workforce development, through training, through ESL classes, through all those things that we need to do and continue to do, we will enhance and make our community stronger, but we're not there yet. And it would take us years to come in order for us to see that again. Before the pandemic, we were like I always tell my families and the people that I talk to, I felt like I was like that close to opening that little gate and throwing people inside so that they can make it. And right now the gates have been closed and we're like in the back of the line, not seeing anything.
Well, we certainly hope for those better days to return soon. And I want to thank you both so much for talking to us here on the podcast. Gladys Vega from the Chelsea Collaborative and Tom Ambrosino, City Manager of Chelsea. Thank you both so much.
Thank you.
And this has been another episode of the podcast from CommonWealth Magazine. Thanks for listening. We will see you next time.